sent a feedback form in our last few videos, and many of you have commented that you need some tips about rapid reporting. So we have Dr. Santosh Rai. Thank you, Dr. Rai, for
Thank
agreeing.
you, Akshay. And I think welcome, guys, to our new episode. Mainly, we have planned this episode on rapid reporting because there was a demand of how to approach rapid reporting because there's some of anxiety with exam going candidates. Rapid reporting is about a very short part of the exam, which is 35 minutes. You get 30 films. The Royal College has come out with some marking scheme of normal and abnormal. Normal films is normal, and you get two marks for it. They will be attaching a document of the Royal College marking scheme. Abnormal image is called abnormal, and you have to write the diagnosis, and you get two marks for it. So total you get about 60 marks. You need 54 to pass. There is a area in normal where the college says inappropriate or false positive, and I think people are wondering what that means maybe. So it is something like the films are vetted by a lot of examiners, and majority of them have felt that that is a normal film, and there could be some findings like a small subchondral changes or a cyst which people can overlook and say, oh, that is there. And if you look that part which they think was normal, they will call it as a false positive because you said it abnormal but it was normal. You will get full marks.
If they write something else other than if it is which is not been.
Yeah. So if that film was said normal based on the finding which they thought, oh, it's normal, but we will consider that. But if you write something different, like a totally different lesion in the film,
Hmm.
which was not their view, then you are calling it overcall. So that's
Okay.
totally negative,
Zero.
0 marks. So that's
Okay.
what it is. So rapid reporting, as such, has no other option, I think, other than practice. So you have to practice. There's no shortcut to rapid reporting. So the main mantra is practice and have a checklist. Checklist is for each body part, like from chest, you have review areas. For abdomen, you have review areas. For spine, you have review areas. For even the bones and skeletal, you have review areas. So review areas are the one which you typically know. For chest is like epiphysis, CP angles, behind the heart, the bony cage. So these are the reviewers. But develop a habit of having a checklist and develop a habit of looking at the edges of the film because that's very good habit to have in your practice session. So abnormality on the film will be definitely there, obvious abnormal. So even if it is subtle finding, it will be obviously a very clear abnormality. There will be only a single abnormality of the film. There will be no two pathologies. Even there are two pathologies, they will be linked to each other in exam, not in courses, but in exam. So make sure the abnormality which you see, don't create it. It's very obvious.
Because you do not get the clinical information in rapid reporting, the chance of overcalling is more. That's why if you are finding it difficult to detect abnormality, it's most likely to be a normal film. As Dr. Rai was telling you, that abnormality will be definite. If you don't find anything in first 15 seconds after going through your review areas and things like that, go with your gut feeling that if you're not finding anything in first 15 seconds of that film, it's more likely to be
I
normal.
think I agree because when the film goes up and you just have 15 seconds about if you feel the film was normal, it will be normal.
If you have time when you finish your rapid reporting session, then you need to go over normal films rather than going over abnormal films, because in abnormal films you have already found out what is there, but in something which you're thinking about as a normal, there might be something in the review area which you have not looked. So it's better to go over normal films rather than abnormal films when your
Yeah,
time is finished. What do you
yeah,
think, Dr.
yeah. I
Raj?
think that's true, but the gut feeling is the main thing.
Main thing, yeah.
And this is where in practice sessions you should see how your gut feeling is.
Okay.
Maybe you will see that, oh, I went back and made it abnormal again. So that's the best
Oh,
thing.
okay.
So that is where I think
So
you have to.
this point is bit, you need to
So
take it
it's
bit,
a technique you
yeah,
develop your own.
yeah,
But the point what Dr. Akshay is saying that if you have left time, please go to your normal films to if you want to really look because abnormal is abnormal. So you made
yes.
it. So that's a good point on that one. The other point in abnormal film, if you don't know the diagnosis, sometimes oh I don't know what it is, but just describe the lesion, what you see, and if there is a fracture and if you don't know the name, better to describe the fracture Don't use any short forms. Use the side which is, if the fracture is intra-articular extension, do mention it because you get full points. Otherwise, you'll be penalized with half marks.
Do they need to mention about displacement and
Yeah,
uh,
yeah, yeah. If you feel that there is a fracture which is intra-articular or lipohemarthrosis with associated with it, you write all the things, soft tissue swelling around, you write all the findings around it with it
okay,
and the side because you don't want to miss any
any
marks. And
marks?
there's nothing wrong because you're pinpointed abnormality anyway, so
Okay.
you're getting more marks on that, and more you're more securing yourself not to lose marks. I would say so. The other point is like, when you're doing the rapid and you say number five, six, seven, oh, normal, normal, normal. And because there's no pattern, they have put the films. There could be a batch of normal, batch of abnormal, abnormal, normal, abnormal. So when you're finding, oh, five normal, and then don't think that I'm making, oh, I'm missing something. Is it something wrong I'm doing? No. You just do with your gut feeling, carry on. It could be a clump of normal, abnormal together. Don't worry.
Another point is when you are having supporting evidences, for example, there is a soft tissue thickening, it will guide you towards fracture. If there is a gas, it will guide you towards foreign body. If there is any erosions there, it will guide towards arthropathies. So you need to around as well. If you're not finding something, you then try to find those things by with help of some supportive evidences. Registrars ask that when they come across prosthetic valve or laminectomy, and there are some other things. Do they come under normal or abnormal?
I
What?
think I think a lot of people who go to courses and all they say we don't know, but they will not keep in exam all these confusing films. So, but I would say that prosthetic wall is abnormal if there is. Laminectomies are surgical, so they are not normal, they are abnormal. Mastectomies, like calcified lymph nodes, very big ones, they also be abnormal. Fused vertebra, soft tissue calcification like calcific tendinitis and all, they are abnormal. Very bad OA is abnormal.
Anatomical variations, they should be put as normal. For example, extra rib, apophysis in children, which can be confused with fracture. So those are the things examiner may like to see, that whether you know what is normal apophysis or not.
Even a minor degeneration or small osteophyte in the spine or early degeneration, they are all considered normal. So they are part of the normal things. Yeah. The exam is 40 to 60% films are either normal or abnormal. So that counts towards either there are 13 to 17 films. So either it could be 13 normal or 17 normal, or it could be the other way around, that 13 abnormal and 17 abnormal. But if you do and you land on 15 or something, and then you are really on the safe margin, because plus 2 minus 2 would be like 27, which is a pass mark.
Okay.
So the tip is like, if you do the first go and you land between 13 to 17, you land between 15 and 14, you are nearly there. Even if you don't touch it again or don't
Yeah.
review it,
Right.
the chances that the exam is 27, which is out of 33 films, you are still plus minus 2. So
Yes.
that is where you should get an idea like 13 to 17. So use that technique when you're practicing to see how it goes because, yeah. But
Yes, and also when you're writing rapids, uh, do think that you need to write down whatever that film is. Do not keep those films at the end, because sometimes time may run out, because there is no negative marking. So you have to attend
uh,
every film, isn't it?
yeah, you have to attempt all the 30. There's nothing wrong in leaving anything. I don't think. But that's a simple tip, but just to make sure that you know about it, that there's nothing wrong to it. Develop a systematic and a consistent approach towards your rapid reporting technique. So this is your personal technique, whether you are one of the gut feeling, whether you are reviewing. So when you do a rapid practice and see that when you did a practice without any changes, you got X. When you went and looked again and again, you really made it worse. So, or you
Mm.
made it better. So this is very personal thing to every individual. And I think you have to develop that technique in your practice to see which way I will go. When I go straight away, I'm very good. When I go over it, I'm not good. Or some people are good when they go over it because they are very fast in looking. And then, so it's a personal technique. I would say
Mm.
that develop your personal technique
Yeah,
of
you need to
practice.
find out whether you are a good guesser or whether you are good good
Yeah, yeah,
person who can correct it.
that's
So
correct.
it not some course can give you. You
Yeah.
have to learn it by yourself,
Yeah, you
by
develop
doing
your
it.
own practice. That's a
Yes.
very, very good thing. And that is where you are developing your skills. And there's nothing very clever about rapid reporting. It's very normal practice. So, what is the main success? I would say is practice as many films as you can and know there's no clean. And just make your practice that you have the error, margin of errors you're reducing as you are going towards the exam. But I will make sure that even if you're getting 27 if your practice session or 26, don't worry because exam is extremely clear and very clear films, so you will be definitely getting good marks in exam. I think that's what practice to be successful, and I hope good luck.
Yeah.
And I hope these tips which we discussed with Dr. Akshay and myself will be helpful for your guidance on rapid reporting and will help you and give us some ideas and comments whether this really worked for you, and in future we may give you some small rapid examples or may give some more packets in the videos also. Thank you very much and good luck.
Thank you.